At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Hord.
Greetings, my name is Christopher Hord, and I'll be your host for the Prevent Blindness Focus on Eye Health podcast. Welcome to our April 2025 episode. Prevent Blindness observes April as Women's Eye Health and Safety Month, and we've got some special information about resources we have available for you. Additionally, we'll have the inspiring story of how a mother and son teamed up to reduce barriers to children's vision screening. Listen to excerpts from an interview by Julie Grutzmacher, Prevent Blindness's Director of Patient Advocacy and Public Health Initiatives. Julie recently sat down with Kim Owens. Kim and her son Kai are the founders of a web and social media service called Navigating Blindness. Like many children, Kai experienced vision loss at a very early age, but was not diagnosed. Now, Kai and Kim spread information to other families who are struggling with barriers to children's vision care. Also, we'll take a closer look at the Prevent Blindness 2025 Focus on Eye Health Summit. Registration is now open for this virtual online event taking place on May 14th.
News.
Prevent Blindness observes April as Women's Eye Health and Safety Month. According to the American Academy of Ophthalmology, 66% of all blind patients are women. 65% of age-related macular degeneration cases are women, and women make up 61% of all patients with cataracts and glaucoma. This is why Prevent Blindness is observing Women's Eye Health and Safety Month. Women often manage health care for the entire family and are caregivers, but it is vitally important for women to protect their own eye health and eye safety. Factors such as aging, hormonal imbalance, or smoking can be major factors in determining eye health. It is important to schedule a regular checkup with eye doctor. Prevent Blindness has assembled a variety of resources on our website. We urge you to check out this information and to talk to your eye health care professional about any issues you may be experiencing.
Feature presentation.
I'm Julie Grutzmacher. I'm the Director of Patient Advocacy and Population Health at Prevent Blindness. And I'm joined today by Kim Owens, a parent and an advocate, a parent to Kai, and we'll hear about his story. So Kim, tell me a little bit about yourself, introduce yourself and your son Kai.
Thanks for having me. My name's Kim Owens. I'm with Navigating Blindness. My son Kai is 22 and he's blind. Together we run a platform called Navigating Blindness. It's a blog and social media with the goal of helping other families to navigate blindness.
Wonderful. And so tell me a little bit more about your journey, Kai's journey, as it relates to his vision. Anything from misdiagnoses to lots of medical appointments as he was growing, specialists, changes in behavior. Anything you want to share about the journey?
Our stories, it was really difficult. So my son Kai had typical sight and he was really fearless. Like his older brother Cash is 4 years older, and it's like Kai just came out ready to do whatever Cash did. And so the boys would skateboard and skimboard and they were always active. And then in kindergarten, we started noticing just like a few issues. He went from being really fearless to not really wanting to leave my side. He didn't like school anymore. He didn't want to go out and play after school. And we knew something was wrong, but we didn't know what. So, in the beginning, we noticed that he was fearful. And when he would play basketball or something with his friends, he would stop and press on his eyes. That was something he started doing regularly, like kindergarten to first grade. He'd push on them, he'd pull on the lateral corners. And that was so intense that his eyes became black and blue. We took him to the doctor and they looked and said, we think it's allergies, give him an allergy pill. And so we did that, but it didn't improve. And his fear and anxiety just continued to increase. So we brought him back to our family doctor and they just thought it was general anxiety. And I just didn't agree because it had happened so quickly. He went from being so active and happy to being really afraid and not wanting to do anything. That just sort of continued. We started visiting other specialists. We went to neurologists. We went to ear, nose, and throat doctors, and nobody really was able to help. We couldn't figure out, what it was. So all of a sudden he became really afraid of the dark. He didn't want to sleep at night. When he would go in and out of doors, he would sort of like stop in his tracks and just be afraid. And we didn't know why. And then around, I would say third grade, we got a call from his teacher saying, he's really distracting the other kids. He keeps standing up when I turn my back to write on the board. He's glancing around the classroom from side to side, distracting everyone. He's not wanting to read. And she asked if he had had a recent eye exam. And he'd had regular eye exams, but I brought him back and the eye doctor said, he has a slight astigmatism, but other than that, everything looks good. Now, knowing what I know now, there's a bunch of questions I wish I had asked at that appointment, but I didn't know then. And then in fourth grade, it was like right around the holidays. I asked him to write his Christmas list for Santa. And I was working in the kitchen and I glanced over at him and he was curled over the table with his left eye just a couple inches from the paper. And so I just thought that was strange. So I walked over behind him and I noticed that he had started his list in the middle of the page and then bunched up all of his words on the right side, but there was nothing on the left side. So I asked, I was like, Kai, why aren't you using the left side of your page? And at that point, he picked up a piece of paper like this, held it at eye height, pulled it to his right, and said, I didn't see that side of the page. And that's when everything changed. Like, I put him in the car. We had an emergency optometry appointment. And I said, I know you've looked at his eyes, but something is wrong. I explained what happened. And that's when he dilated his eyes and looked closer and noticed that he had some pigmentation on his retina. So that just put us into this, like, we got referred to a pediatric ophthalmologist. He had an electroretinogram, and they came back and said that he had retinitis pigmentosa, which is a degenerative retinal disease that's usually really slow progressing. And Kai was already legally blind when we found this out. He had less than 20 degrees of sight. His central vision was still good, though, and that's why he was able to sort of pass as sighted. He had a very small window of sight. And that's when we, once we had his diagnosis, we were able to get him into the programs he needed in school, like get his IEP. He learned to use a white cane. He learned to read Braille. He used assistive technology. But he went through 4 years of school completely unsupported. And that just breaks my heart because he went from just being active and happy to being sad, depressed, scared. But I'm happy to report once he had the right tools and the right skills, his zest for life came back and he went back to doing board sports. He took advanced level class and he actually graduated as valedictorian of his large public school. And he is a senior at the University of Georgia now, getting ready to move to Manhattan for grad school. So he's thriving now.
It must have been so difficult as a parent who is, you're moving, you're observing all of his behaviors. You know him better than anybody else. You're taking him to all of these specialist appointments, and how great that the teacher was able to be curious about the fact that it could be his vision that's causing, some different behaviors. And you followed up and you took the teacher's advice and you went to the optometrist. And for whatever reason, that in that first optometry appointment, it was not detected, his vision condition. So aside from astigmatism, but tell me more about looking back at that time and that appointment. What questions do you wish you would have asked that eye doctor, and what could you recommend for other parents?
I think it's really important for parents to ask questions. I just took him at his word that Kai's sight was normal, but we had signs that nobody could figure out what it was. So I wish I had asked, like, clearly, what is his visual acuity? Number one. Number two, I wish I had asked, does he have the full range of peripheral sight? I feel like had I asked that, perhaps the doctor would have checked that. I don't think that's something that is typically checked with children, and I think it's important that it is. I wish I had asked if his retinas and optic nerves appeared healthy, but again, I had no awareness of blindness or childhood blindness. I wish I had asked how his eye pressures were. His are normal, but a lot of children with early vision loss do have problems with their eye pressures. And really a sign that was really missed is the pushing and pulling on his eyes. That I wish I had asked, why is he doing that? Is that related to his vision? That is one of the first signs of problems with children's sight. I wish I had asked, what are some signs and symptoms of decreased vision? And if he recommended any specific measures for overall eye health. The pushing and the pulling on the eyes and the peripheral sight are things that I really wish we had caught. Also, being afraid of the dark. He hadn't been afraid of the dark, and all of a sudden he was. It turns out he had night blindness, which is one of the main signs of retinitis pigmentosa, LCA, and a lot of other childhood vision issues.
Wow, those are such great questions and great recommendations for other parents. When we think about funding for programs and early detection, about the EDV Act, the Early Detection of Vision Impairment in Children's Act, a piece of legislation that was just recently introduced in the spring of 2024 by Prevent Blindness and our Congressional Vision Caucus co-chairs. So it's a bipartisan piece of legislation that would be the first of its kind. It's modeled after the hearing EDI, which is a hearing program to detect hearing loss in children and infants and children. But this would screen and ideally provide services via the federal government to every state in the nation. And so it would make it so that for the first time ever, children are getting screened on a regular basis and hooked into services. When you think about your own experience, how would the EDV Act have helped you? Why do you think that this piece of legislation is really important for children like Kai and other children who have various eye conditions?
Well, I had read, which really surprised me, that 1 in 122 children have unpreventable vision issues. Kai falls into that category since his is genetic. It's also autoimmune, we found out later. But, a lot of children, more than 50% or 50%, I think it is, have preventable vision issues. And so if those could be caught early, that would be great. I also would hope that anybody screening children at an early age would know, the typical signs and symptoms, the pushing on the eyes, the pulling on the lateral corners of the eyes. I just feel like it could really help a lot of children to get into the proper line of support, to, be referred on to somebody more knowledgeable or somebody who specializes in childhood vision issues. It took a really long time for us to get to that step. I feel like if somebody, we were just taking him to our general optician who saw us. So he probably didn't have as much experience with children. I feel like if somebody was screening for childhood sight loss, they maybe would have caught things earlier for us. And then Kai could have received the services earlier. And also, childhood blindness doesn't only affect children. These children grow up. And so, having the services early, the supports in school, will help children to be able to grow into adults who have the proper skill set, the proper education, and, it will increase opportunities for employment as well. So I just feel like the earlier we can catch issues, the better.
And Kai's story is such a testament to that, where, once he got plugged into services and had the access devices he needed, he really thrived in school. So tell us a little bit about your journey of starting navigating blindness with Kai. At what point did you start that blog? What propelled you to do it? What need was unmet as you saw it?
Oh, it's interesting. I didn't mention this before, but we lived in a very rural area. So we had very limited medical professionals in our area. And so, I feel like a lot of the signs that were missed should have been caught. And Kai should have been in the program to receive vision services at school a lot earlier. So when he turned 16, we talked a lot about how difficult it had been and how we wished that somebody had told us, what to look for. I was Googling, why is my son pressing on his eyes? Why is he pulling on the corners? Why is he afraid of the dark all of a sudden? I was Googling all these things and just not finding answers. So I wanted to create a platform along with Kai that when people were searching those things, they would find them. And so we post a lot of content about, the first stages of Kai's sight loss. We also talk to other families and they share their stories on our blog and our social media. And then also a big part of what we do is helping parents through the acceptance process. People, when they find out their child is losing their sight, is very overwhelming. Most people don't even know somebody who's blind. And so we really work to build a sense of community and connect people to the adults and resources that might be able to help them. So acceptance is a big part, building community is a big part, and then just like really explaining to parents, the white cane is a tool, it's a good thing. There are so many emotions that parents and families go through when their child starts using these tools. And so we want to promote the effectiveness and how like their child can really just return back to participating and being included and having their needs met when they embrace these tools. And in my experience, if a child is really resistant to using these tools, it's usually because the parent is really resistant to their child using those tools. And so we're trying to kind of bridge that gap.
Inviting Kai to also participate with you in developing this blog and coaching other parents to get to, acceptance and trying to uncover the fear around using the white cane, not believing it's a tool, what do you think was the impact on Kai at sort of a young formative age to be doing this sort of advocacy work?
That was really helpful. It was in the beginning, like people started reaching out to us and they still do. And if they were within driving range, we would offer to meet them. I remember meeting one little boy and his family who were very resistant to a white cane. And they met Kai and the little boy was like, he's so cool. I want to start using my cane now. And he started using his cane. And another family who the father was really against Braille. Like, he did not want his child to look different. But then we met them, and Kai brought his Braille display and used it and showed the dad, how it worked and how he was able to do math and science because he had access to this. And now that boy is graduating high school and going to college, and he uses Braille and all the tools he needs. So, like, we had some early wins. Like, it gives me chills thinking about it. So he got to go to these schools, meet the kids, speak to the kids, and that was really a great experience for him and, for all the kids he met.
Wow, that's fantastic. So last question is around any advice that you have for parents. You've touched on some of it, of course, with the great questions to ask, the ways to get involved, to kind of channel, the experience into advocacy. But any other advice that you have for other parents who have visually impaired or blind children?
The thing that was most helpful for me was getting to know blind adults and understanding, how they lived life, how what their challenges were, and being able to ask them questions when I had questions. So mentorship, I think mentorship's super important. We try to be that for other families, and it was hugely important for us. I would also say, if you are not getting the answer, like if in your heart and in your gut, you think you are not getting the full story or the right answers, don't give up. Just keep looking. And to know that there's advocates and people out there that can help you if you're running into trouble at school.
Well, Kim, thank you so much for your time today and for your willingness to talk about your own experience and Kai's experience to really help other parents.
Thanks for having me. I really enjoyed it. And I loved the Aspect program. I was part of cohort 8, and I would highly recommend the program to anybody who's listening.
Ooh, tell us a little bit about the Aspect program.
Oh, okay. Yeah, I found out about it through two friends who had gone through the program. And so I applied on the Prevent Blindness website, and I was accepted into cohort 8. For me, I already do a lot of advocacy, but it was like local and like family to family type advocacy. And so what really interested me about the program was learning how to advocate at like a state level and a national level, how to understand how to track certain things that are going through, Congress, and really how to show up and how to, speak out and have my voice heard. So since joining that program, I contact my representatives regularly. I'm sure they love that. But I tell them, anytime there's an issue that's sort of in my awareness that I'm concerned about, I contact them. I share a small bit of my story of why it's important and, make my voice heard. So that has been really helpful.
Special guest.
Janetta Price is an advocate, publisher, writer, and founder and CEO of Blind Girl Magic. She is the visionary behind the best-selling anthology, The Right to Heal, and leads a series of seminars using writing to help participants recover from traumatic loss. Additionally, she is a program manager for Prevent Blindness's Aspect program, which helps train members to learn how to use their own personal stories as a tool for advocacy. We are proud to feature her performing her spoken word piece, Blind Girl Magic.
Blind Girl Magic is the type of magic that struts in the room with her white cane extended. Her hips shift like the motion of the eyes of the sighted. Who would have guessed that this blind girl possessed magic. Abracadabra. Now you convinced that I have some type of magical superpower with a supernatural S on my chest. Well, that would be yes for success. As I leap over adversity, dodge negativity, slam misconceptions of society, slap I can'ts in the face where I did that is a fact that blind girl magic goes back to Helen Keller. Way back to Harriet Tubman. Born into slavery, escaped the freedom, but she did not stop. She went back and back and back to lead others to freedom. Blind girl magic is built off the shoulders of phenomenal women. Blind girl magic is an independent movement that is leading our blind community to freedom of depression, low self-esteem, lack of confidence, anger, bitterness, rejection. Abracadabra, you are set free. Blind girl magic lives within me.
Announcements.
The Focus on Eye Health Expert Series presents Dr. Maria Sampalis. Prevent Blindness's Focus on Eye Health Expert Series is a collection of videos and articles from professionals in medical care and academic research. These experts discuss advances in eye care and eye health. This month, Prevent Blindness's Vice President of Public Health and Policy, Kira Baldonado, interviews optometrist Dr. Maria Sampalis. The two discuss why there is a discrepancy in the number of women patients with eye health issues. They also address ways to improve eye health and eye safety for everyone.
I have patients that I just saw, they're 30 years old. I diagnosed them as a glaucoma suspect. We always ask about family history. The patients didn't know. They did while they were dialing, text their family members and found out that the family members do have glaucoma. And those are good things to know as an eye doctor, be able to diagnose a disease earlier and provide treatment for them soon for better outcomes for them as well. And also talking about lifestyle changes that can help their eye health if they're more prone to macular degeneration, sunglasses, nutraceuticals, talking about screen time, that's very important as well. And understanding that the eye is as a whole to the body, it's just not for that too. We diagnose a lot more other diseases systemically from the eye.
This is just an excerpt. To hear the entire interview, visit the Focus on Eye Health Expert series on our website. And be sure to check back for regular updates to learn more about eye health and vision care for yourself and for your loved ones. Just a reminder, registration is now open for Prevent Blindness's 2025 Focus on Eye Health Summit. Registration is free for all attendees. To register or for more information, visit our website at preventblindness.org or check the links in the show notes. This online virtual event is a groundbreaking gathering of medical professionals, policymakers, patient advocates, and innovators. Together, they will exchange ideas, share experiences, and create strategies to promote equitable access to vision care. Through dynamic keynote presentations, panel discussions, and interactive coffee chats, attendees will explore topics such as innovations in vision care and technology, public health strategies to reduce preventable blindness, policy frameworks to integrate eye health into broader healthcare systems, and more. This virtual summit takes place on May 14th from 11 a.m. to 5 p.m. Eastern Daylight Time, or catch highlights later on our YouTube channel. Sponsorships for the 2025 Focus on Eye Health Summit are available. For more information on sponsorships, email eyesummit@preventblindness.org. That's EYESUMMIT at preventblindness.org.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.
Thanks for listening. Please join us for next month's episode, where we will have more news, announcements, and features of interest to the blind and low vision community and those who work with them. Please subscribe to the podcast on your favorite podcast distributor. If you have a smart device, try asking it for Prevent Blindness Focus on Eye Health podcast. Have suggestions or tips? Contact us by emailing podcast@preventblindness.org. We can't reply to every email we receive, but we read them all. Enjoy and share.